Did you know that vitamin D isn't just for bone health? In fact, studies show that over 77% of women struggling with infertility have low vitamin D levels, which can impact everything from egg quality to hormone balance. In this video, I'm going to show you how a deficiency in this crucial nutrient can impact your fertility. Also, I want to share with you natural integrative ways to boost your vitamin D and support your fertility journey. If you don't know me, I'm Dr. Gina Rosella Terinoni. I'm a board-certified doctor of acupuncture and Chinese medicine. I'm also certified in women's health care as an integrative medicine practitioner. I use 2,000-plus-year-old medical practices with the latest in scientific research so you don't have to. In the past almost 25 years, I've helped over 2,000 women and couples to become pregnant over the age of 35 and have healthy babies. Stay around because all of my videos have at least one, if not several, actions from health tips that I give you, and you can start them the same day. And also, please subscribe to my channel and also check in the notes or in the comments for a 15% off discount to my online pharmacy of vetted high-quality supplements like vitamin D, as well as specific supplements for fertility in general that I use with my fertility patients and clients. When it comes to fertility, the health of your eggs plays a crucial role. Vitamin D has a direct impact on your ovarian function and overall egg quality. Research shows that vitamin D receptors are present in the ovaries. This nutrient plays a role in follicle development, ovulation, and even embryo implantation. Studies also suggest that vitamin D improves the ovarian environment, supporting healthy follicle development, and women with optimal vitamin D levels have significantly higher rates in IVF for success. One study found that women with sufficient vitamin D levels had up to a 33% higher chance of achieving a successful pregnancy through IVF compared to those women who were deficient in vitamin D. Let's look at the consequences of deficiency. Low vitamin D levels are linked to lower AMH levels, a marker for ovarian reserve. Vitamin D deficiencies can worsen symptoms of polycystic ovarian syndrome or PCOS, making ovulation much more difficult. And let's also look at the impacts of low vitamin D on endometriosis. Emerging research shows that vitamin D deficiency may increase the risk of developing endometriosis. Now, let's look at sperm quality and vitamin D. Just like egg quality in women, vitamin D is vital for male fertility, particularly for sperm. Men with adequate levels of vitamin D are more likely to have better sperm function and reproductive outcomes. It also helps to boost testosterone levels, and this is crucial for sperm production. And men with higher vitamin D levels show improved sperm motility, increasing chances of fertilization. Poor sperm quality, we can look at low vitamin D levels. They're associated with reducing sperm count and motility, negatively impacting fertility health and ability to get pregnant with their partner. A deficiency in vitamin D can disrupt the hormonal balance necessary for sperm to develop. Maintaining the right balance of vitamin D is key to optimizing fertility. While deficiencies are common, excessive vitamin D can also cause problems. Vitamin D levels, specifically 25 hydroxyvitamin D, should be between about 30 and 50 for optimal reproductive health. Let's talk about getting your vitamin D levels checked. To know your vitamin D status, your healthcare provider can order a simple vitamin D test. If you're getting other fertility lab work, please have them check your vitamin D. This test measures the amount of vitamin D circulating in your bloodstream. Most experts recommend checking vitamin D levels every 3 to 6 months. I can tell you personally, I think I was 35 or 36. I wasn't trying to get pregnant at the time, but I wanted to get my levels checked to have a baseline and see what I should start working on when I wanted to start trying to get pregnant. And the only thing that came back was I was very low in vitamin D. And this surprised me because at the time, I was training with triathlons and I was outside with my team probably 15 hours a week in full sun. Now, this is a topic for a different video, but just being outside can help with vitamin D. But it also depends on where you live. Where I live in Colorado, a lot of people tend to be deficient in vitamin D. And I didn't know that because we have so much sunshine. Get your vitamin D levels checked because I was shocked. I started supplementing with vitamin D and my levels came up in a few months. No problem. And I still take it because it's really helpful with your immune system as well, which is a big link with fertility. Low vitamin D can disrupt reproductive hormones affecting ovulation, and we said already, sperm production. The deficiency can increase the risk of preeclampsia and gestational diabetes. I have seen this a lot in my practice. It's definitely worth adding in to use as prevention. But taking too much vitamin D can lead to hypercalcemia, causing nausea and kidney problems. If you're trying to conceive, you've had trouble keeping enough or too much vitamin D, then work with a local doctor and get your labs tested every 3 months. So let's look at the recommendations. Again, check with your doctor. I'm not your doctor. I'm just trying to be helpful based on my experience in my clinic. Adults generally need about 600 to 800 IUs. Pregnant women can require a higher dose. So again, consult with your healthcare practitioner or your doctor. Sunlight is a natural source. Some people still may not get enough due to factors like skin tone or location. This is why we supplement, and this is why it's necessary. If we're looking at prenatal vitamins, most prenatal vitamins contain 400 to 1,000 IUs. That's probably not enough. Studies suggest that pregnant women may need up to 4,000 IUs daily to maintain healthy levels. Now, this is something kind of a side note with taking prenatals. Often hear, vitamin E, vitamin C, folic acid. Hear all these list of supplements that are necessary. And you may pick up a prenatal and go, it's got everything I need. But you have to make sure when they're putting all these components into one pill or a couple pills, they can't fit a whole lot. Sometimes they're giving you the smallest dose, which is fine. It's a baseline, but often you'd have to supplement on top of that. Just know that even though they're called prenatal vitamins, it doesn't mean they're all inclusive. You would be taking 10 to 15 pills a day. So definitely have a look, and you can even write out what the dosage is, what the different elements of that one multi are. If you want, you can drop them in the comments below and I'll look at them because they really do fluctuate. So here's some of the best foods that are high in vitamin D. Fatty fish, salmon. I recommend salmon all the time, but you've got to make sure it's wild caught so the mercury levels aren't too high. But salmon, mackerel, sardines, they provide up to 600 to 1,000 IUs per serving. Egg yolks. I love eggs for fertility. I love them in general. Eggs are wonderful. They also really help with egg quality. So eating eggs are a really good food for fertility. Fortified foods. Foods like milks and cereals often say they're fortified with vitamin D, but the effectiveness can vary. I would not rely on it. They're definitely not providing sufficient amounts of vitamin D. Anything that says fortified, just check. It could be the smallest amount and they can put that on their label. Focus on naturally vitamin D rich foods and supplements, but get your levels checked. And sunlight, spending 10 to 30 minutes of midday sunlight on exposed skin is ideal. People with darker skin tones or those in northern latitudes probably need more. This isn't a conversation about sunscreen. There's many different opinions on that. If you're using sunscreen 50, then you won't be able to absorb vitamin D. So something to take into consideration. If you're like, I don't want to be in the sun like that, then you're going to be looking at supplementation. Take vitamin D with meals containing healthy fats to improve absorption. This is the other thing is different vitamins you want to take on an empty, some you want to take with food or specifically fats. Vitamin D is one of them. Pairing vitamin D with magnesium and vitamin K2 can also enhance its effectiveness. Vitamin D plays a crucial role in reproductive health, influencing egg and sperm quality, hormonal balance, and pregnancy outcomes, in addition to really helpful with your immune system as well. Be sure to maintain optimal levels by getting regular blood tests and adjusting your intake of vitamin D through sunlight, diet, supplements. Always consult your healthcare practitioner for personalized information. Many people ask me grand questions and I say, I don't have any idea what your medical history is. I can't make recommendations like that, but I can point you in the right direction. If you have any questions, drop them below. And check show notes for all kinds of goodies.